Hey everybody, Dr. Derek Gatta. We're the co-founders here at RiseWell. Excited to have you tonight where we have a great guest lined up for our conversation. We have Dr. Maya Assi from right here at Alpha Dental here in Coral Springs, Florida. And we're going to be talking about how biohacking in dentistry can help your overall health and much more. So Dr. Maya, if you're out there, I'm going to go ahead and invite you to join. And then we can get our conversation started. Dr. Maya, we should be set. Hey, everybody out there is waiting to join here, waiting for Dr. Maya. Hey, Maya, how's it going?
How are
Hey,
you? Good.
hey, wonderful. Thank you for taking the time to join our conversation tonight.
Absolutely. I'm so excited.
Wonderful. I'm going to go ahead and just start and read your bio just so our audience can kind of get a better sense of who you are and your background a little bit here. So Dr. Maya C is a proud graduate of the Nova Southeastern College of Dental Medicine and an active member of the American Academy of General Dentistry, American Academy of Clear Aligners, Academy of Biomimetic Dentistry, and International Academy of Oral Medicine and Oral Toxicology. In addition, she is certified in ozone therapy, a Gold Plus preferred Invisalign provider, a certified DSD provider, and a certified BioClear provider. She continues to push the envelope by utilizing top-of-the-line technology to treat her patients, from digital scanning and 3D printing to in-house milling, ozone therapy, and beyond. Dr. Maya always encompasses a traditional, functional, and biomimetic approach to modern dentistry. Truly loving her craft, she continues to learn and elevate the highest quality approach to treating all her patients. Wow, you've got so many certifications and credentials. That's great.
Thank you.
So tell our audience a little bit about your background and your journey into dentistry and how you kind of ended up where you are.
It's been an absolutely amazing journey. Obviously, I was traditionally trained, and throughout my own personal journey with my own health and some, very life-changing things that I discovered with a few of my patients, it kind of made me want to dig deeper into how the mouth connected to the rest of the body. And it made me realize that oftentimes, I say this a lot, and I've said it in different interviews, I don't know at which point the mouth was separated from the rest of the body.
Yeah, exactly.
Even when we're trained in dental school, we're definitely trained to connect the two, but we're so ultra focused on perfecting our craft. We're so ultra focused on perfecting the processes of what we're putting in there that becomes more of a priority to most of us. But kind of stepping back and realizing that the materials we use, not only the procedures we provide, are also very, very important to the health of the rest of the body.
Yeah, that's a great point. And I think I was only a couple years behind you and your husband at Nova there. And look, I applaud traditional dental education. They're trying to turn out competent, safe dentists who are not going to harm the general population. And, in 4 years, I guess the curriculum just isn't big enough or broad enough to accommodate some of the new treatment modalities that are out there. And I'm thankful for the education I received, but a little disappointed that some of these concepts that we're now continuing to learn and integrate into our practices, it sounds like, kind of didn't get much exposure in the traditional dental school curriculum.
For sure. And it is a lifelong journey of learning. I feel like it took me, a while just to get comfortable with the way I was sitting, the way I was prepping, and
Sure.
all of that. So it's a huge paradigm shift to learn something completely new, to kind of unlearn a couple of things that we did learn. You have to kind of get into a little bit of an uncomfortable space there for a little bit. But I'm really glad I did it because it's allowed me to completely change my personal health and the health of many of my patients.
Yeah, you make a great point. I feel like when you become uncomfortable, that's when you grow the most, when you're willing to take on these new challenges and new treatment modalities and expand and grow. So tell me also, the term biohacking, I heard there was recently a conference down here in South Florida on biohacking, and you were able to speak and tell us about that and kind of your experiences with that conference and what you were able to share and learn.
Thank you. Yes, and I have to start off by saying thank you to RiseWell. You guys have been one of the most pleasant companies to deal with.
Oh, thank you.
Part of my journey is to get the word out there, and I want my fellow biohackers to know you know, some things that they should stay away from as far as the mouth. And, you know, we were looking for a great hydroxyapatite based toothpaste company to partner with, to present. And your company was absolutely amazing. I have to congratulate you and
Thank you.
everybody that stands for the brand. And it's actually really, really a wonderful, wonderful, you know, now I know this isn't a commercial, but it's really a wonderful brand, and it's really such great people to work with. I want to thank you for that.
Oh, that means a lot to my team, and I thank you so much.
You know, I got into biohacking a few years ago. Dear friend of mine, Natasha Coles, she's actually the owner of the Biohack Lab down in Fort Lauderdale. If anybody's down in that area, it's definitely worth a visit. She taught me what biohacking is, and ever since then I have never been in a healthier place, healthier space in my brain, in my body, in my health. And what basically everybody looks at me and like, what's biohacking? And everybody I'll take it the way that Dave Asprey explains it. He's considered the father of biohacking. He actually invented the term. And what it is really is changing a little thing here and there in your environment internally and in order. And it's not just, you know, you think about like food and diet, that's like an easy, you know, that's the first thing you think of.
Sure.
Eat clean, but it goes so much more beyond that. It, you know, it can be the light that we allow ourselves to see. It can be the vibrations that we allow ourselves to feel, or the vibrations that we emit. It can be anywhere from energetic connections, in recognizing that everything is really connected and keeping everything open. It's quantum energy. Biohacking encompasses everything in our environment that we can change, tweak in order to optimize. And that's what really brought me to biological dentistry and to speak at the biohacking conferences, because biohackers are amazing. I learn so much from that community. It's mind-blowing. But I did realize in speaking to many biohackers over the year that they're doing everything that they can most of the time to biohack their bodies, but oftentimes kind of the missing link is the oral cavity.
Sure.
And so that put me in a mission where I had to get the word out. I felt like it was my duty to my fellow biohackers to make the connection, because, you know, it's there, but I feel like talking about it a little bit more in depth, and then being able to present some easy things that we can do right away, like that can help get cleaner and healthier on our journey.
I love that, and it's great. It's funny, as you mentioned the term biohacking and Dave Asprey, I guess the birth of RiseWell is because we were experimenting biohacking, amateur biohackers back in the day, about 5-6 years ago now. My sister and brother-in-law, we started the company, and my sister had been very open about some of her fertility challenges, and they had to go through the IVF process, and looking to live a more clean, healthy lifestyle. They started with food, because food's the obvious thing. Okay, doc said you're spending a lot of money on this process. You want to increase your chance of success. Start eating better. It's like, okay, they started doing that. And then they really took a deep dive into their beauty products, dermatology products, oral hygiene products. And, although we were not the first, we applaud other companies that are out there in this space. But, I was a dentist down here in South Florida. We have very health conscious, high dental IQ patients down here. And we were able to team up and come up with a product that was able to help people get rid of the unnecessary toxins and detergents in their oral care product. Use hydroxyapatite, which is considered a little bit a better remineralizer without some of the health challenges that fluoride poses for some people. Now it's kind of the journey of the amateur biohacking that the three of us did to kind of found RiseWell and help our patients and people across the country here. But I'm glad that message and the other tips you picked up from the conference are resonating as well. And maybe we'll see more of that stuff in traditional dental school curriculum at some point here. Kind of tell me more about Alpha Dental and about your practice and what you enjoy doing and what you may do differently compared to other colleagues in the community, and how you kind of approach your patient population.
Sure, definitely. I mean, a lot of what you see it is going to be the same. So people say, so you're a biological dentist, do you do cleanings or, do you do fillings? Yes, we do. But what we do is we really take the person, the patient as an individual. What we prefer to do is do a biocompatibility test to start out with, where this is going to test your own body's serum against any and all dental materials that we might use on you. That'll let me know whether or not what I'm going to put in is compatible to your body. So I often say, if you're gluten intolerant and you eat some gluten, your body's going to have a bad reaction. You may be ill for a few days, but then eventually you'll get rid of it because it's not a permanent fixture in your body. But what if we were putting something in your body that your body was intolerant to and your body couldn't get rid of it? So your body is constantly low level trying to fight this specific material because it's not happy with it. You get elevated CRPs, you inflammatory, and you can't really understand why. So the first thing we do is this biocompatibility test so that we can figure out what needs to be done, but also what type of material we're going to put in that it's safe to your specific biology. We do a lot of implants. My husband's a board certified implantologist, and some people, titanium implants are not that great. Not, there are some things we know are toxic and we stay away from them, like fluoride, like mercury, but there are other things that we have to based each person's individual situation. And so a biocompatibility test will be our number one. A saliva test to test the oral microbiome is another thing that you'll commonly see at our office. That lets us know exactly what's going on, the ratio for good to bad bacteria. It lets us be more intentional and gear the recommendations that we make for your home care geared more towards what you specifically have going on.
Okay.
And we also do meridian charting. So we take a look at all the 12 major meridians, what you have going on in the teeth associated with those meridians, so we can kind of see if there are any disconnects going on in the mouth. But we also do x-rays to see what's going on. We also do cleanings. We offer ozone cleanings, which is just absolutely amazing. If you've never had an ozone cleaning, you have to try it. And boy, my brain can go on. So we offer dentistry, fillings, crowns, restorations, implants, but we try to do it more in like a catered to your biology type of way.
Yeah, you have a lot of good buzzwords in there that I want to expound upon in a moment here, but I also love how you phrase that, biological dentistry, it's not that we're forgetting or dismissing a lot of what conventional dentistry does. I mean, we do a lot of conventional dentistry as well. We're not throwing the baby out with the bathwater here. We're taking a lot of those principles in, but it sounds like you're really just creating a more custom experience for clients on avoiding the materials that shouldn't be in their body, incorporating more health-conscious materials, and offering services that a traditional dentist might not offer. And in terms of the testing, is that a blood test you're referring to, or how do you do that custom testing?
The biocompatibility test is a blood test.
Okay.
Our assistants are also certified phlebotomists.
Okay.
So they will draw your blood and we will spin it and send it out to the lab. And within a week, we get a results back. And we also are able to give our patient, it's like a 200-page report. We help them sort through it, and we also give them a copy. So if they ever move, they have that with them to take it to their next biological dentist.
Oh, that's a wonderful service. That's great.
Are certified in phlebotomy because we also do PRF, where we draw your blood, we spin it, and we get all of the platelet-rich fibrin to form a clot, and we put it back into the extraction site or the surgical site. That's biohacking your body, because usually takes about 10 days for your body to get all of those factors in at the site.
Okay.
putting it day of surgery, you're healing 10 times faster. You're basically taking all of those healing factors and putting it in same time of surgery. You're also avoiding any, cavitations from forming and stuff like that. But so there are a lot of little different biohacks that we add on to the procedures that we provide.
It sounds like a great way to accelerate the healing process. That's wonderful. I'm curious, one of the things that struck my interest was that term microbiome. Can you explain to our listeners what that means and how that relates to the mouth, and how you guys approach and try and help heal that?
So if you think about the gut, right? Testing the microbiome, which is everything, the bacteria, potential viruses, potential parasites, potential amoeba, type of environment, candida, any type of environmental bugs that are in the gut is the microbiome. And it's the same in the mouth. We share 40% of the microbiome that's in the gut is in the mouth. That's why oftentimes when your dentist looks in your mouth, they can kind of say, maybe this person is having, maybe this person has Crohn's disease, or maybe this person has some sort of deficiency. So we test, it's a simple saliva test. We test this through the spit, through the saliva. We can test this microbiome, this environment that's going on.
Okay.
And that environment, just like the gut, you want it to be in balance. You don't want the bad bugs to supersede the good bugs. You don't want to wipe off anything that is beneficial to you completely. You want a balance there. And it's the same in the mouth. So, like instead of using harsh rinses, like those alcohol-based rinses that
Sure.
thinking that we had to use, using something more conducive to the microbiome, using probiotics.
You bring up a lot of good points there, and that's why we do not use alcohol in our rinse, and we have a pH balancing formula, because really it's interesting. Back in dental school, it's kind of this scorched earth, bacteria bad, kill everything mentality, and it really wasn't until some other biohackers, and also I believe I read that book 10% Human a while back, looking at how there's so much good bacteria in our body that we've been inadvertently just killing with overuse of antibiotics and alcoholic rinses, and not really understanding this communication and symbiotic relationship between the bacteria in our bodies. And when you blanketly just kill everything, you create these ecological niches where other invaders can come in and overpopulate and lead to other health conditions. So it's so great that message is getting out there and really helping to spread that the information on the connection of the oral and gut microbiome.
Yes, a lot of amazing insights. A lot of people tell me, I don't know where to start. Where do I start? I say, well, I think you should check your microbiome. I think you should check your gut microbiome, and you should check your mouth microbiome and start there.
No, it's such a good service. There's one more thing that you had mentioned in that comment about the meridians. I'm not super educated about that, so tell us about the meridians and how that fits into your practice, and how people can benefit from that treatment.
I feel that everything is energy. Everything is energy and vibration at the end of the day. And when we form, our body forms across neurologically 12 major meridians that spread in all the way down to the tips of our toes. And those meridians also happen to pass through, dental, our oral cavity. And if you take a look, I wish I had a chart with me here, but if you take a look, you can see where, and it's been proven with electroacupuncture that, this point is connected to this point, is connected to this point. And so we can, for example, take a patient who, maybe having some, let's just say, bladder issues. We are not diagnosing bladder issues at all, but we can say, hey, you know what? I know that you've mentioned that you have these bladder issues. It looks like you have maybe something associated in this area. Let's get you over to your functional medicine doctor as we treat, let's say, the infection that's right here. Let's have them check out what may be going on with your bladder at the same time. So oftentimes what is going on regionally in the body can be seen in the tooth, and the same thing, the tooth can be seen regionally in the body as well. And I have to say this now, partnering with a great functional medicine doctor is very important. Let's say you're trying to detox from mercury,
Sure.
and you go use the smart removal to remove them. Also having a partner in health to help detox or to help give us some clues as body is very important as well. It's not enough to know that it's there. It's what are you going to do about it?
That sounds like a great team approach, and that your patients are able to benefit from that. That's wonderful. You mentioned a term that I'm not sure everyone's familiar with. The amalgam removal. Was it smart amalgam removal? How does that work, and what does that mean exactly?
So we all were taught that these mercury fillings are mixed with silver, and because they were mixed with silver, it causes the mercury to become innate and they're safe. I believe that that's not true. Every single time you bite or brush your teeth or rub your teeth against these mercury fillings that you have in there, a little bit of mercury vapor is released every time. They've acknowledged that this is true, but they have said that is a little bit of mercury vapor is released every time, but we don't believe that that's enough to be detrimental to health. The little bit that's, for me, it's like you're saying, I'm going to release a little bit of arsenic into your body every single day. It's such a low amount that it's not going to really bother you. So keep that feeling there. Now, if you decide that you're going to remove these mercury fillings from your mouth, it is absolutely important that you remove them safely. The technique that we use is called SMART, Safe Mercury Amalgam Removal Technique. It is a technique where we completely isolate the patient 100%. There's 100% pure oxygen being pumped into the patient's nose. The tooth or teeth that we're working on, we put the rubber dam on it, which means that only that tooth or those teeth that we're working on is showing. The rest of the mouth is isolated. We use a high suction vac on the extraorally. We use air filtration units. We ourselves are, completely dressed from head to toe in order to prevent this mercury vapor from being inhaled by the patient or inhaled by me or my assistant. We remove these very, very methodically, very safely, in order to prevent an increase in mercury vapor while we're removing them. Then once we remove them, we want to try to replace them as biomimetically as possible, where we're trying to copy the flexure of the dentin to the enamel, or trying to be very copy the anatomy of the tooth instead of being, try to be less aggressive with what we're replacing it with. And when we're replacing it, we know which type of material you're most compatible with. And so that's what we're going to go for.
With that term, biomimetic, it sounds like you've taken some courses with Dr. Pascal Monnier. So that's great. And yeah, biomimetic is the way to go. And sounds like a great service to help people with all their old metal fillings.
Yes.
I'm curious. So any other techniques that are you want to highlight? I don't know, oil pulling or maybe tell us how the benefits of ozone. But I'd like to touch on those topics and just help educate people out there considering those treatment modalities.
Yeah, coconut oil pulling is my fave. I love it. I do it every day. I wake up before the kids get up, and because I have about like 20 minutes to myself, I take some raw coconut paste, I put it in my mouth, I chew it up until it becomes liquid, and I start, pulling it through.
Okay.
That oil itself is very detoxifying to the oral environment, but the movement, we always forget the muscles associated, right? Myofunctional therapy, very important.
Sure.
Strengthening your gastric, strengthening your tongue. That movement, it's an exercise.
Okay.
You do it for minutes, it's great. You do it for 20, you feel
Sure.
it. You feel that you're making that movement, that exercise. So I do that first thing in the morning, and then I don't swallow it because now it's full. It's pulled out toxins that are there. I spit it into my little cup. I wait for it to get hard again, and then I throw it in the trash can, and then I continue with my basic routine, which involves brushing with RiseWell hydroxyapatite toothpaste, tongue scraping, and using a probiotic, an oral probiotic.
No, that's great to hear, and I'm glad it seems to be helping, and that information is getting out there to a lot of your patients. I'm curious about the role of vitamin D, and we're watching some of your videos online and checking out your website, and it seems that you're really in tune with some of the essential vitamins that may help in the healing process and getting people as healthy as possible before surgery. How do you advise people on dietary supplements and vitamins of that nature?
So interesting, at our study club meeting a few meetings back, we had the opportunity to have Dr. Rick Myron, who is an absolute genius to almost and talking to some studies that were made as far as the levels of vitamin D and their association with implant. So we now know that very, very important. We known for a while it's very important for transporting calcium to the teeth and the bones. But we know that low deficient vitamin D levels will contribute to implant failure, which we see a lot of people here. Believe it or not, we're in sunny Florida.
Yeah.
A lot of it's very important to make sure, Weston Price and that factor X that he talked about, that's K2, D3K2. So vitamin K2 go together. It's kind of like, it describes it like it's the taxi that takes things where it needs to be taken.
Yeah.
I don't know if I'm allowed to name some other brands, but there's one I take religiously. It's liposomal D3K2. I absolutely love it. It's easy to take. It's a pump. I have it at my desk in the morning, and that's how I know my levels are good. We also, we should be able to, we do test our patients for their vitamin D levels.
It's such an economical way to make sure someone is as healthy as they can be before surgery. I mean, anyone can most likely afford some vitamin D supplements and just get their levels up to make sure they're in the best healing capacity before any dental extractions or implants or procedures they have. So, it's really super thorough that you guys analyze all that.
For sure. And, DK2, that's the beginning of it. There are so many things that we can do very simply by making sure that we're taking micronutrients, minerals, humic and fulvic minerals, magnesium, very simple things that we can do, all of which help, not only the oral environment, but the rest of the body.
I love that. That's great. And also looking at some of the factors, we've spoken about so many terms and things and procedures tonight. Are there any other opportunities or things that you want to cover, or I want to be respectful of your time? Anything else you wanted to share with the audience or go over? Because I had kind of gone through the things that were interesting to me so far.
Man, I mean, I think that we could sit and talk about this,
That's true.
Night long. I find it fascinating. I'm constantly learning. I told my friend Petra, I'm a baby biological dentist. I feel like every single day I am learning, and I am on my journey to learn, but I'm excited to share what I've learned. And what I would say probably to anybody out there watching is, you deserve to be treated as an individual and not one size fits all. Your care, not only your oral health care, but your body, your personal, your mental care should be individualized to you. And so, biological dentistry just starts with catering your biology, your needs, your goals, your wants to you and your goals in life. And, you deserve it. You deserve slow dentistry. You deserve somebody that's going to take time to sit with you. Just like RiseWell took time to understand, this is what we needed for the conference, and you guys made it happen. We all deserve that. We deserve to slow down, to be heard, and to be taken care of.
No, I love that. It's so great. And you know, there was something you mentioned previously that I wanted to expound upon a little bit was the work by Dr. Weston Price, and it's so wild that it all goes back to nutrition. I mean, here was just for the audience who may not know, but back in the 1930s, a dentist took time out of his practice, so like several years, where he traveled the globe and was really looking at these different indigenous populations and how there's such a low incidence of caries and periodontal disease in populations that were far removed from the Western diet with refined carbohydrates and sugars. No surprise, as soon as those populations became exposed through ports and trading posts and interactions with the West, unfortunately their caries and periodontal rates went up. But it was a really just wonderful deep dive into how it all goes back to nutrition. A lot of what we're treating is preventable, and I'm sure you guys speak routinely about nutrition, but that's something I speak routinely about here in my office. And a lot of patients are kind of a little surprised. They're kind of so used to a doctor just prescribing a pill or prescribing a treatment. I was like, what's this guy talking about nutrition for? We're paying a lot of money to come here. I know how to eat. It's like, yeah, no, I know you know how to eat, but it all goes back to sugars and refined carbohydrates, and essentially everything you eat reduces the protein, fat, or sugar. And so it doesn't necessarily have to be something sweet and dessert, but a lot of the crackers and the pastas and the breads, they're all reducing the sugars at some level. So really making sure you brush, floss, and keep that debris off your teeth so it doesn't allow the substrate for the bacteria to create the acids for decay to occur.
That if it comes in a bag, or
yeah.
We're guilty of that too in the bag.
Sure.
Sometimes you'll see, but if you can avoid anything that comes in a box or a bag, anything processed foods, try to eat raw, try to eat clean, and definitely make sure that you're taking care of your oral hygiene.
Absolutely. Absolutely. Hey, Maya, I'm going to scroll through. If there are any questions at the bottom of the screen, if any viewers want to ask Dr. Maya anything, now's a good time, or me. I'm going to scroll and see if there were any. Not seeing any yet, but appreciate everyone who logged on and joined us here. Dr. Maya, how can people support you and your husband? Where can we find you? Do you have any interesting projects or announcements coming up for the future? What has you excited for 2024?
It's really how we can support you guys.
Okay.
Really, it's really how we can support you guys. Anybody listening here, anybody have questions, anybody lost, even if you're in another state, even if you're in another country and you need guidance and you need love and you need, a power of positivity and vibration, we are here for you. And I mean that. You guys can email us, message us, ask us questions, and, we're happy to guide you with any of the knowledge and love that we have, for real.
Well, I love that. Well, thank you for taking the time out tonight to talk to our community. Everybody go check out Dr. Maya and her husband at Alpha Dental here in Coral Springs, Florida. And, we wish you the best, and thank you so much for holding space with us.
Thank you so much for taking time. I appreciate you, and I hope to see you in person soon.
Absolutely. Take care.
Good night.
Bye-bye. Hey, everybody. Dr. Derek